The content of this podcast is provided for general informational purposes only and is not intended as, nor should it be considered a substitute for professional medical advice. Hello again, this is Karen Nickel, family nurse practitioner, and you are listening to Itchy and Bitchy, a podcast that provides answers to your many health questions. I have more and more patients who are diagnosed with non-alcoholic fatty liver disease, and most, if not all, the patients who get this diagnosis have no idea what it is or what it means or what to do about it. So I thought I could talk to you today about this increasingly common problem and what you can do to avoid it and to address it. In a healthy body, the liver removes toxins and produces bile, which is a protein that breaks down fat into fatty acids so that they can be digested. It's a very important organ, as you can imagine. And fatty liver disease damages the liver and prevents it from working as well as it should. But lifestyle changes can prevent it and keep it from getting worse. I'm going to talk to you today about non-alcoholic fatty liver versus alcoholic fatty liver. There are two types of non-alcoholic fatty liver disease, which we abbreviate NAFLD for short, but that's not a lot shorter, but there it is. Non-alcoholic fatty liver is generally a benign condition in which there is fatty infiltration but no inflammation. That is the official definition, and it is true that inflammatory changes may not be measurable in NAFLD, but it is an inflammatory process, so it is important to work to correct it. The other type is non-alcoholic steatohepatitis, and this is also referred to as NASH, N-A-S-H, in which there is fatty infiltration along with liver inflammation. Non-alcoholic fatty liver disease is seen worldwide and is the most common liver disorder in Western countries, where the major risk factors for NAFLD include central obesity, type 2 diabetes, high cholesterol, and metabolic syndrome is common. So in these Western countries, we have these problems very commonly, and all of these issues can lead to NASH. Alcohol abuse and other conditions can also lead to liver problems. To be diagnosed with either form of NAFLD, a person must not have a history of heavy alcohol use or another problem that might be causing the liver condition like hepatitis C or B. So this is completely unrelated to a viral infection or alcohol use. In NAFLD, the liver functions normally, and there are usually no symptoms, but NAFL is often found when a person has elevated liver enzymes on blood testing that leads to imaging as part of the workup for the lab findings. It is also often discovered when imaging tests of the abdomen are done for other reasons, such as an ultrasound done to look for gallstones. If you are overweight or obese, losing weight can reduce the amount of fat in your liver. Aside from this, there is no treatment for NAFL, although you should be vaccinated against hepatitis A and B, which can also damage the liver if you're not already immune to those viruses. Many patients with NAFLD never develop inflammation or the form of NASH, although some do. But again, for all this to be happening, there is some inflammation present. It just may not be measurable on imaging. NASH is a condition that causes inflammation and accumulation of fat and scar tissue in the liver. So we start seeing scarring in NASH. Again, a similar condition can occur in people who abuse alcohol, but NASH occurs in those who drink little to no alcohol. The exact cause of NASH is unknown. However, it is seen more frequently, again, in people with certain medical conditions such as diabetes, obesity, and insulin resistance. This combination of disorders is often called the metabolic syndrome. You may have heard of that term before. So more than 70% of people with NASH are obese. Up to 75% of people with NASH have type 2 diabetes. And this, as you know, is a disorder that disrupts the way your body uses sugar. So normally sugar gets up into the cells with the help of a hormone called insulin, which is made in the pancreas. In people with type 2 diabetes, the body stops responding to normal or high levels of insulin, which causes sugar to build up in the blood. And eventually the pancreas becomes unable to produce insulin. So that's the whole type 2 diabetes process. About 20 to 80% of people with NASH have high blood triglyceride levels and or high blood bad cholesterol levels, like your LDL. Insulin resistance also is a problem that is associated with NASH. And insulin resistance refers to a state in which the body just doesn't respond adequately to insulin, but the person doesn't yet have type 2 diabetes. So it's a precursor to, or can be a precursor to type 2 diabetes. And insulin resistance often occurs in people with high cholesterol and who are obese. And lack of exercise is one of the main causes of insulin resistance. Several drugs that are used to treat other medical conditions have been linked to NASH, including amiodarone, which is an antiarrhythmic for people who have heart rhythms, abnormal heart rhythms, tamoxifen, which is a breast cancer drug, steroids like prednisone, and synthetic estrogen. And certain pesticides actually have also been linked to NASH. It is not clear how many people have NASH because it typically causes no symptoms. Again, we tend to find it what we call incidentally. We stumble upon it because blood tests are abnormal, and then we get some imaging and we see the fatty liver. However, NASH is diagnosed in about 3 to 5% of people in the U.S. who have a liver biopsy, which, that can be done to check for a number of different liver conditions. And most people who get NASH are between the ages of 40 and 60 years old. And although the condition can occur in children over the age of 10, but mostly in ages 40 to 60. NASH is seen more often in women than men. And probably that synthetic estrogen probably plays a role in all that, but I don't have studies to confirm that. Treatment of NASH focuses on controlling some of the medical conditions associated with it that I just reviewed and monitoring for progression. So we try to make some lifestyle changes, hope to make some lifestyle changes, and then we just keep checking in the liver to make sure it's not progressing. As with non-alcoholic fatty liver disease, people with NASH should be vaccinated against hepatitis A and B if they're not already immune. So how is NASH diagnosed? And as I said, it most often is discovered following routine blood tests that show elevated liver enzymes. So you go for your annual physical and you get a test called a CMP, a comprehensive metabolic panel that includes your blood sugar, your electrolytes, your kidney and liver function. And typically with fatty liver, those liver enzymes will be elevated. Additional tests can help confirm the presence of NASH and rule out other types of liver disease. Again, a liver biopsy can confirm NASH and other causes of liver problems. So blood tests to measure liver function measure levels of substances produced or metabolized by the liver. And these levels can help to diagnose NASH and differentiate NASH from alcoholic hepatitis. So especially the levels of two liver enzymes, one is AST and the other is ALT, that are elevated typically in about 90% of people with NASH. Additional blood tests are useful for ruling out other causes of liver disease, and these include tests for like viral hepatitis, like hepatitis A, B, C. We can check for mononucleosis that can cause some liver enzyme elevations, etc. Imaging tests such as ultrasound, CT scan, or MRI can can reveal fat accumulation in the liver, but those tests really don't differentiate between non-alcoholic fatty liver and NASH from other causes of liver disease that have similar appearance, because we're just looking at the appearance of the liver and commenting on the amount of fat that's been stored in the liver. Although other tests may suggest a diagnosis of NASH, sometimes a liver biopsy is required to confirm it. A liver biopsy may be needed if other causes of liver disease cannot be ruled out with standard blood and imaging tests. So a liver biopsy can also help determine the severity of the inflammation and detect liver scarring. And this scarring is called fibrosis, or when it becomes even more severe, it's called cirrhosis. And I'm sure many of you have heard of cirrhosis of the liver. Biopsy can also provide clues about future course of the condition, and the procedure involves collecting a small sample of liver tissue, which is sent to the laboratory for microscopic examination. And it's not the most pleasant of tests, so fortunately we have something called a FibroScan now that is non-invasive. And it's an ultrasound technique that determines how stiff the liver is. So it measures the stiffness of the liver. And this stiffness can then be used to estimate how much scarring there is in the liver and to determine if cirrhosis has developed. Where available, FibroScan is an alternative to liver biopsy for detective liver scarring. And I think most GI docs are doing this versus liver biopsy. And so this kind of testing is usually done in a gastroenterologist's office. So next up, after this little break, I'm going to talk about symptoms that can occur with fatty liver. Be right back. I frequently talk to you about the importance of eating a healthy diet. As a matter of fact, we are talking about that very thing on today's episode. I find that a lot of people don't really know what it means to follow a healthy diet, but Green Chef can guide you because they have a meal plan for every healthy lifestyle. Keto, paleo, plant-powered diets, or even if you just want to have delicious but balanced dishes. Green Chef offers 35 nutritious and super flavorful options to choose from every week. I have many patients who want to transition to a plant-based diet, and with Green Chef, you can take homemade plant-based meals to the next level with Green Chef's plant-powered options. And on today's episode, we're talking about Mediterranean diet. They have Mediterranean options. You can pick that plan. All of you carb-conscious people out there can take advantage of their keto and paleo options, which will give you the premium proteins and vital veggies you need to power through your day. Green Chef is the first USDA-certified organic meal kit. So you can enjoy hand-picked organic veggies and premium proteins without having to worry about where they are sourced. And my listeners will know that it is so important to me that Green Chef is the most sustainable meal kit, offsetting 100% of their plastic use and 100% of their carbon footprint and emissions. So you can enjoy your greens while being green. I am making kidney bean cheeseburgers tonight. This plant-based burger is topped with Monterey Jack cheese and creamy chimichurri with a side of roasted potato wedges. One bonus of this recipe is that it makes 4 patties, so you can use the extras as a filling for wraps or a topping for a salad. This recipe is packed with foods that are needed to help maintain optimal health. Go to greenchef.com/itchy130 and use code itchy130 to get $130 off plus free shipping. Go to greenchef.com/itchy130 and use code itchy130 to get $130 off plus free shipping. Green Chef, the #1 meal kit for eating well. So, do people with fatty liver or NASH have symptoms? Well, most people don't have symptoms. As I was saying, my patients, we find it incidentally. They have no idea they have fatty liver until we get an ultrasound because of blood testing. However, in some people, in both the early and late stages of fatty liver disease, may notice right upper abdominal pain. The liver is located in this area, and the pain often begins as a dull ache that comes and goes. And some people have described it as a sensation of fullness, and the pain may also radiate to the center of the abdomen, like towards your belly button. In the later stages of fatty liver disease, the pain becomes more severe, and you might notice a loss of appetite or nausea or vomiting. An enlarged liver can occur, and it occurs due to the buildup of fat in the organ. So you're plumping up the organ with a bunch of fat. Patients with an enlarged liver might also observe enlarged blood vessels just beneath the surface of the skin over the liver area. A healthy liver is tucked up under the ribs, and on exam, the liver is not felt below the bottom rib. So when we're examining and we press down on your belly, we should not feel that liver edge below that bottom rib. If the liver edge can be felt below that bottom rib, that indicates that the liver is enlarged. Exact liver size can be determined with ultrasound, CT, or MRI again. And patients who have an enlarged liver might need to have these tests repeated regularly to track the progress of the disease. Weight loss can also sometimes reduce the size of the liver. Both types of fatty liver disease may trigger chronic fatigue. And I know this can be sort of confusing because we have fatigue for a lot of reasons, but patients might notice that they feel more tired than what is normal for them, and especially after regular activities, including like household chores. They may feel the need to sleep for longer periods than they usually do at night, and some patients find that they need to take naps for several hours during the day as well. Chronic fatigue could severely impact an affected individual's work or school, and it could result in having to take an extended absence. So when we have chronic fatigue that's really severe, it's going to really impact your functionality at work, home, school. Since chronic fatigue really can be a sign of several potentially serious conditions, patients really should seek appointment with their primary care practitioner if this symptom worsens or persists for longer than 2 weeks, so that all that can be teased out and figure out what's causing that chronic fatigue. Keeping a diary of your sleep hours and any daytime naps could also be really useful information at your visit. So the more information you give at your visit, the better the history, the easier it is to narrow down what's happening to you and causing your fatigue. An enlarged spleen often develops in the later stages of fatty liver disease, and the spleen is located in the left upper quadrant of the abdomen, and the spleen is normally about 5 inches long and 3 inches wide. And females tend to have smaller spleens than males, and that's true for the liver as well. And taller individuals have longer spleens than shorter people. It all goes with body type. Although the spleen may not be felt in healthy individuals, and it usually is not, doctors or nurse practitioners or physician's assistants, whoever's doing your exam, can often identify an enlarged spleen in patients who are ill. Again, the spleen is usually tucked up under the ribs, so you should not be able to feel it below the bottom rib on abdominal exam. Measurements can be refined with ultrasounds or other images like CT or MRI. The spleen size may decrease with the treatment of fatty liver disease, and regular ultrasounds can monitor a patient's status. In rare cases, the enlarged spleen might need to be surgically removed. There are certain situations where it just has to be removed. Patients in the later stages of fatty liver disease may notice jaundice, and many people are familiar with this term, but it is a yellowing of the skin or the eyes. And this symptom indicates that the liver is not functioning properly because it can no longer filter bilirubin, which is a yellow liquid. And so because it's not done effectively, it starts saturating skin and eyes. Individuals with jaundice might also experience intense itching of the skin, and they could also develop redness of the palms and abdominal swelling. And since jaundice can be a sign of cancer, patients who observe any of these changes in their skin color should definitely see their practitioner if these symptoms do not resolve within a week, especially if skin itchiness is also present. Unexplained weight loss can sometimes be a sign of fatty liver disease. Some estimates indicate that up to 20% of adults in the U.S. can have some form of the disease, and between 70 and 90% of individuals who are overweight or obese are affected by fatty liver. And one of the main treatments prescribed are, to make changes in the diet and exercise in your life. However, if individuals notice rapid weight loss that occurs without any significant changes to their diet, is worth talking to your provider to find out what's going on. The fat cells that are around the liver aren't what cause the weight loss. However, if individuals develop insulin resistance, this can lead them to rapidly lose weight because their body is struggling to store more sugar where it's supposed to be. So this is a classic symptom of diabetes, like new onset diabetes. If you have no idea that that's happening, some people will just drop tremendous amounts of weight all of a sudden. Leg and abdominal swelling isn't seen with every type of liver disease. However, swelling in the abdomen and the legs is often present when there's cirrhosis, which occurs when the liver, becomes scarred, as we discussed earlier. Every injury to the liver causes the liver to attempt to repair itself, and that results in scar tissue. And the more scar tissue that forms, the more difficult it is for the liver to function. If someone develops advanced cirrhosis, their liver may fail, which is life-threatening unless they're able to get a liver transplant. So when swelling occurs in the ankles, feet, or legs, it's called edema, and it is called ascites when fluid accumulates inside the abdomen. Patients also might experience itchy skin, nausea, fatigue, easy bruising or bleeding, again, yellow discoloration of the eyes or skin, and spider-like blood vessels on the skin. Again, redness of the palms can also occur. General malaise can occur with multiple kinds of fatty liver disease, though it can be difficult to categorize. And malaise is a general feeling of unwellness, so it's a really non-specific symptom that people can have. Affected individuals might have trouble explaining why they feel unwell beyond that their body feels like it isn't calibrated correctly or functioning correctly. Many patients experiencing malaise also experience nausea, lethargy, and fatigue, even after having a good night's sleep. Patients might feel as though they're experiencing digestive problems, too, that can't resolve or don't resolve. Malaise may be one of the most frustrating symptoms to diagnose because it is very difficult to define and accompanies a wide range of different conditions. And when individuals are experiencing consistent and ongoing feelings of unwellness, one of the best things they can do is talk to a health practitioner and provide them with as specific symptoms as possible. Again, it's all about the history. Some studies indicate that fatigue and malaise are the most commonly experienced symptoms of any type of fatty liver disease. Some of this fatigue might be caused by actual chemical changes in the brain that is caused by the fatty liver. But if you see your provider for this complaint of just generally not feeling well, the more information you can give, the better it is in terms of narrowing down a diagnosis for you. Nausea and vomiting are some of the most classically observed signs of liver disease. They might occur in individuals who have non-alcoholic fatty liver disease, and they're also common in those whose liver disease is related to alcohol. So either one can be affected that way. Sometimes taking large amounts of acetaminophen, which is Tylenol, and other similar drugs can have a damaging effect on the liver. And other diseases like hepatitis and hemochromatosis can cause the liver to become damaged over time. Hemochromatosis is a disease process where there is too much iron in the blood. So we start storing iron in all our major organs, and including the liver, and you're basically turning your organs to stone. And it is a inherited disease process. So if you have any family members who have a diagnosis of hemochromatosis, you need to tell your provider so they can be monitoring your your hemoglobin and hematocrit and your iron levels, and possibly test you for genetic predisposition to hemochromatosis. When patients experience nausea and vomiting as a result of liver disease, they might not realize they're linked to the liver at first, so they might not see their doctor about the symptoms until it's lasted for quite a long time. However, it's really important to get liver disease diagnosed and treated early to prevent irreparable damage to the liver. Again, that's scarring, fibrosis. When the vomiting and nausea are related to the liver, patients will also often experience jaundice, weight loss, and generalized fatigue. And the treatment, again, will vary depending on what type of fatty liver disease the patient has. So, again, a lot of these are have a few more symptoms, but a lot of these symptoms are with more advanced disease. So, in the really early stages, you may not have anything except maybe an occasional achy liver. Confusion and difficulty focusing can also occur. When individuals are feeling fatigue, there's often a sense of fogginess that sort of comes along with it, but the difficulty focusing can also become even more serious. Severe confusion is a neurologic symptom, so it can be a really key warning sign of cirrhosis. So if your liver is not functioning well, you're not filtering toxins through your liver well, you can end up with these neurologic symptoms because your brain's getting all this junk fed to it. Advanced cirrhosis can lead to liver failure, and since the human body cannot function without the liver, this condition can be life-threatening unless patients get a liver transplant, but that's way, way down the road. In addition to the difficulty focusing and the confusion that patients who have cirrhosis may experience, they might also be unusually drowsy and have slurred speech. They may appear outwardly as though they're drunk, even though they haven't had any alcohol. This is a condition called hepatic encephalopathy, and it occurs when the patient's brain function declines because of severe progressive liver disease. In this case, the liver isn't removing toxins adequately from the blood, which leads to toxins that built up in the bloodstream and are going to your brain. So, are there treatments or things that we can do to help prevent NASH or fatty liver disease? There really is no cure for NASH, but treatment really aims to control the conditions that are associated with NASH, such as obesity, diabetes, and hyperlipidemia. Several experimental treatments are being studied with drugs that treat insulin resistance. Weight loss, losing weight, can help reduce levels of liver enzymes and insulin and can improve your quality of life. Weight loss should be gradual, for example, 1 to 2 pounds a week, since rapid weight loss has been associated with the worsening of liver disease. So we want to make that correction, lose some weight, but rapid weight loss is not a healthy way to do it. A healthcare provider or nutritionist can provide an individual weight loss plan for you if that's needed. Treatment of insulin resistance is also important. Again, several drugs are available to treat insulin resistance, but exercise really is the key piece in preventing or correcting insulin resistance. I recommend 150 minutes a week, 150 minutes a week of aerobic exercise to prevent or correct insulin resistance. Vitamin E can also be useful for people with severe forms of NASH and who do not also have diabetes or heart disease. Healthcare providers sometimes recommend supplements of vitamin E. There is some evidence that vitamin E might reduce some of the liver damage that occurs as part of NASH. However, do not take vitamin E unless you are told by your healthcare provider to do so. Obviously, avoid alcohol. People with NASH shouldn't be drinking alcohol because it makes the liver problem worse. There are foods that can help with liver health. One of them is coffee. Coffee can actually help lower abnormal liver enzymes. So your daily cup of coffee could help protect your liver against non-alcoholic fatty liver disease. A 2021 review found that regular coffee consumption is associated with a lower risk of developing NAFLD, as well as a decreased risk of the advancement of liver fibrosis in those who are already diagnosed with NAFLD. So caffeine also appears to lower the number of abnormal liver enzymes in people who are at risk for liver disease. This is excellent news for me since I have coffee every day, but I don't go crazy. I'm 1 or 2 cups a day. But I'm pleased to see that that's one of the main things that can help you with liver function. Greens also help prevent fat buildup. So compounds found in spinach and other leafy greens may help fight fatty liver disease. So eating spinach can lower the risk of NAFLD, possibly due to the nitrate and specific plant phenols that are found in leafy greens. Interestingly, raw spinach has been found to provide this benefit, but cooked spinach did not have the same strong results. This could be because cooking spinach and other leafy greens may result in lower plant phenol content and also reduced antioxidant activity. Both beans and soy have shown promise when it comes to reducing risk of NAFLD. Legumes such as lentils, chickpeas, soybeans, and peas are not only nutritionally dense foods, but also contain resistant starches that help improve gut health. And in my last podcast, we talked about constipation and how much fiber these legumes have. So it's covering a lot of bases. So crack out those lentils, chickpeas, etc. Consumption of legumes may even help lower blood glucose and triglycerides in individuals living with obesity. In addition, a 2019 study found that diets rich in legumes specifically helped lower the likelihood of NAFLD. Again, crack out those lentils, crack out those chickpeas. Eating soy may help protect the liver, mostly because soy contains a high content of a certain protein noted for its ability to help lower triglyceride levels and possibly protect against visceral fat buildup. Additionally, tofu is a low-fat food that serves as a good source of protein, making it an ideal choice if you're trying to limit your fat consumption. Fatty fish such as salmon, sardines, tuna, and trout are high in omega-3 fatty acids. Supplementing with omega-3 fatty acids benefit those with NAFLD by reducing liver fat, boosting protective HDL, that's our good cholesterol, and lowering triglyceride levels. Oatmeal as a fiber is a great thing to add as well. A nutritious diet rich in high fiber foods like oats is effective for those with NAFLD and may help reduce triglyceride levels. And again, remember all those legumes, high fiber, super high fiber. A diet rich in nuts is associated with reduced inflammation, reduced insulin resistance, decreased oxidative stress, and a lower prevalence of NAFLD. Research has found that people with fatty liver disease who eat walnuts improve liver function tests. Turmeric can be taken to reduce markers of liver damage. High doses of curcumin, which is the active ingredient in turmeric, has anti-inflammatory properties that might reduce markers of liver damage in people with NAFLD. And many of you probably already know about or are taking turmeric or curcumin as an anti-inflammatory to help with joint or muscle pain. Sunflower seeds are particularly high in vitamin E, which is an antioxidant that is often used in supplement form in the treatment of NAFLD. While most research around fatty liver and vitamin E focuses on supplements, a 100 gram serving of sunflower seeds has about 20 milligrams of vitamin E, which is more than 100% of the daily recommended value. If you're looking to increase your vitamin E consumption naturally, sunflower seeds are a very good starting point. You also want to increase unsaturated fat intake. Swapping out sources of saturated fat like butter, fatty cuts of meat, sausages, cured meats, for unsaturated fat sources like avocados, olive oil, nut butter, fatty fish. That change may be helpful for people with NAFLD. This is why the Mediterranean diet is sometimes recommended for people living with fatty liver, because it focuses on foods containing unsaturated fats, as well as its ability to help reduce total cholesterol. So if you need some guidance on how to change your diet so you're eliminating saturated fats or decreasing saturated fats and changing over to unsaturated fats, a Mediterranean diet is a really good option for you. Garlic is also something that can improve overall health. This vegetable not only adds flavor to food, but small experimental studies also show that garlic powder supplements may help reduce body weight and fat in people with fatty liver disease. In a recent 2020 study, patients with NAFLD that took 800 milligrams of garlic powder per day for 15 weeks saw reductions in liver fat and improved enzyme levels. Okay, foods to absolutely avoid if you have fatty liver and limit or avoid if you want to prevent fatty liver include alcohol. As we said before, alcohol is a big stressor on the liver, and it is a major cause of fatty liver disease as well as other liver diseases. Stay away from sugary foods such as candy, cookies, sodas, fruit juices. High blood sugar increases the amount of fat buildup in your liver. If you're not burning all that sugar you're eating, guess what? Your body's trying to store it somewhere, and it's going to store it in the form of fat in your liver. Avoid fried foods. These are high in fat and high in calories. Consuming too much salt can increase the risk of NAFLD. It's recommended to limit sodium intake to less than 2,300 milligrams per day. And believe me, you will reach that goal quickly if you're not careful. And people who have high blood pressure really should limit salt intake to no more than 2,000 milligrams per day. White flour is typically highly processed, and items made from it can raise your blood sugar more than whole grains due to lack of fiber. So avoid highly processed grains. Another thing to avoid is red meat. Beef and deli meats are high in saturated fat. NASH is typically a chronic, lifelong condition. It is difficult to predict the progression of NASH in an individual. Few factors have been useful in predicting the course of this condition, although features in the liver biopsy can be helpful. The good news is many people with NASH will not develop serious liver problems. One study shows that most people with NASH live as long as those who do not have NASH. Furthermore, liver function tests are stable over time in most people with NASH. However, in some people, NASH gets worse over time. The most serious complication of NASH is cirrhosis. As I mentioned earlier, People with NASH often have the metabolic syndrome of insulin resistance, obesity, and hyperlipidemia. And that syndrome puts you at increased risk for heart disease as well as liver disease. So the good news is that treatments for NASH, particularly weight loss, also help treat other problems like heart disease that are part of the metabolic syndrome. As you probably know by now, I am saying once again how important a healthy diet and regular exercise are to provide not only a healthy liver, but overall good health. Please visit our Facebook page, I&B Podcast, where you can leave more comments or questions. We love to hear from you. Please visit our website at itchyandbitchy.com. There's a blog portion where you can read blogs that I've posted on there. Many thanks to Green Chef for sponsoring today's episode. And as always, thanks to Forrest Winsel, our producer and composer of our theme music. Again, he has released an album called An Awful Lot. Make sure you go to wherever you stream your favorite music to listen. And if you don't know where to stream music, you can find the album on Apple Music or Spotify. As always, remember that your health is in your hands. Take care.